Hello, and thanks for watching. This is the third in our 2016 quality video series. As you know, Kindred has identified 5 pillars of clinical excellence that are vital for the delivery of high-quality outcomes for our patients. The quality of the care we deliver, the service we provide, the function we restore or maintain, the compassion we show our patients and each other, and the quality of our physicians, without whom none of this is possible. This video is about those physicians. Like all of healthcare, today's physician workforce is evolving rapidly. Over half of all American physicians are now directly employed. Women make up a growing proportion of the total physician workforce because half of all medical school graduates are now women. A large wave of doctors is approaching retirement, including many in post-acute and long-term care. And like everyone in healthcare, doctors are trying to figure out how to manage their time and their business as more healthcare is being paid based on quality and value.
This is a really hard time for doctors. For some reason, there has been a myth that when you get out of medical school, you enter this land, this life that in a lot of ways had not changed. You're admired, you're well paid, you're sought after, and now the needs of the country have changed. We're changing those people from the one-man shop to the quarterback of a team.
Our physician strategy starts with giving doctors the tools and resources they need to improve performance and quality in our core businesses. And that starts with the data. Kindred now has physician-specific data that doctors can use to see how their patients fare, how their work intersects with post-acute quality measures, and where there is room for improvement. Those reports are being used by our chief medical officers, who must now conduct a complete annual review of every branch and main facility medical director before their contract is renewed. In medical school and residency, doctors receive very little training in post-acute and long-term care, and Kindred is filling that gap. Our hospice and acute rehab physician education programs, for example, are comprehensive, and they set Kindred apart in the physician community as a great place to practice and to learn.
I have an orientation process of reaching out to the medical director. I make sure that they're meeting with all the key team leaders they're going to be working with so they really understand their role. We have tools and resources on a rehab medical director resource site, so I walk them through the resources that are there. And just like you would have an interview, you say, boy, what do you think you're going to need to help you be successful? Where are your gaps and where can I help fill those?
And when it comes to engagement, frequent and valuable physician communication is critical. With that in mind, we are developing a mobile physician communication platform that will connect Kindred physicians with us and with each other. We'll deliver the tools and resources we've discussed to their mobile phones, and will once again differentiate Kindred as an organization that values doctors across the continuum. Our physician strategy involves new physician engagement models and relationships, which we've been piloting in multiple markets. For the past 2 years, Kindred has regional medical directors that oversee physician relations, serve as the point person for doctors at large hospitals and health systems, and lead our efforts in alternative payment models like bundled payment and ACOs. Kindred is also the largest provider of home-based primary care through Kindred House Calls. Lastly, we have begun employing small numbers of physicians and nurse practitioners across our core business lines. These efforts to strengthen our physician pillar of clinical excellence share a common goal: to give our doctors on the front lines the tools they need to be successful.
You know, you have all these different pressures today around who's reimbursing for what, about who employs whom, about who's caring for what. At the end of the day, the last time I checked, it's still the doctor who gets to write the order. It's still the doctor who gets to decide what the best path for that patient is. It's still the physician who is the most trusted advisor that each of the patients that we see at Kindred ultimately looks to say, what do I do next, doc, to figure out how to get myself better?
As a physician who has practiced in multiple Kindred sites of service, I want to thank you personally for everything you do for our patients each day. And if you have ideas about how to better support our doctors, please reach out and share them. And thank you for watching today's quality video.